Welcome to the eClinicalWorks podcast. I'm Adam Siladi. In our last podcast on meaningful use, we spoke about how it's mandatory for practices to be on a 2014 certified EMR, in our case, eClinicalWorks version 10, for all stages of meaningful use. And for those practices that are past their first year of participation, their performance is tied to a calendar quarter. With the majority of practices now on version 10, we wanted to spend some time discussing some specifics of meeting Stage 2 requirements with the eClinicalWorks EMR. Joining me today is Kathryn Johnson, senior member of the eClinicalWorks Meaningful Use team, who's here to explain the steps necessary to be successful in that endeavor. Kathryn, thanks for joining us today.
Thanks for having me.
Now, you've identified several areas that might be making practices nervous about meeting Stage 2. What are some of the things that have been causing the most concern or confusion?
So the first couple are involving the Measure 15 Summary of Care record, both the electronic exchange with a test EHR and hitting the 10% threshold of sending out your referrals or consult notes electronically. Also imaging results, which is a menu measure in Stage 2, structured encoded family history, the 5% patient interaction measures, and also patient reminders.
So you spoke about electronic exchange. Let's talk about that first. Now, when I was on the P2P team, there was a lot of talk going around about something called a direct address being developed. Where does that fit into Stage 2?
So a direct address is required for Stage 2. It's something that you can be issued through eClinicalWorks. We do suggest that you do that now. Go ahead and get your direct address issued so that you can get started with those electronic exchange measures. You can do that actually from the P2P settings in eClinicalWorks. You just go in, you type in your first name, last name, the name of your organization, and the abbreviation you would use for that organization, and eClinicalWorks will issue you a direct address.
So from the admin band, using the eClinicalWorks P2P administration settings, you're able to request your direct address from there with the information you just mentioned.
Yep.
Perfect.
Correct.
So what else is required as part of that? Because just having a direct address isn't all you need, right?
Right. So once you do have your direct address, you can actually go on to the EHR randomizer site and you can get matched with the test EHR. You can go through the steps that we have listed on our user guide that's available on my.eclinicalworks.com. But basically the steps involve registering as a provider, giving them some information about eClinicalWorks, and then generating a match.
So the practices need this direct address, but just having a direct address isn't enough, right? You have to do something with it.
Correct, yeah. So you actually will use your direct address to register on the EHR randomizer website. You can follow the steps listed in our Stage 2 user's guide that's available on the support portal. But basically you're going to go on to the website, register as a provider, enter some information about eClinicalWorks, and then generate a match to whom you'll send a test referral to meet the Part 3 of the Summary of Care measure.
And this is a specific site, right? It's not the CMS site. It's nothing that you get to through my.eclinicalworks.com. It's its own page.
It's its own site. So it's ehr-randomizer.nist.gov.
And we're going to put that link at the bottom of the podcast screen so that you can click on that when you're ready. Yeah. Now, what else do they have to do? Once they get this randomizer thing, is there any other setup that they have to do that they might not be aware of?
Well, it's really important that when they are going through that randomizer process that they choose no when it asks if eClinicalWorks is a member of Direct Trust. That will ensure that they get a vendor who we can send a test referral to successfully. So once you have all that setup done, you can actually go into eClinicalWorks, and when you're choosing the provider that you're sending to on your referral, just change the state to Massachusetts and change the type of provider to P2P provider. And when you type in your test referral vendor, you'll see them pop up in the list, and you can just send it directly from there.
Sounds pretty easy. So there's also a performance measure associated with this, right? Because this is actually one of the three-part measure.
Right. So the performance part is requiring that you send 10% of the referrals that you send out of your office through P2P so electronically. We do have some tips for doing that. The new address book that's available when you're sending a referral in eClinicalWorks version 10 makes it really easy for you to find P2P providers. So you can look in your state and city and see which providers around you are using P2P and send it to those providers. If you have a provider who you want to send to that is not using eClinicalWorks, you can still have them go to P2P Open and join there, and then they'll be added to your address book and you can send to them as well.
So we've got an enhanced P2P address book that makes it a lot easier for me to find somebody to send something through P2P. But once I've found them, what do I do?
So there's a couple different workflows for meeting this measure. If you are someone who deals more with primary care, you're likely going to be sending outgoing referrals. Those can actually be sent from the treatment section of the progress note or from the hub. You just want to make sure that you are attaching the CCD/CCR, so checking off that box, to make sure that it's getting you credit for meaningful use. If you are a specialist, there's also a couple different options you have for meeting this measure, because you're going to be likely sending back either a patient record or a progress note. So the first option is from the patient hub. Just beneath the picture, there is an option to share patient record. You can do it through that method. The other option is from the Common Send feature that's new to version 10. You can actually click on that. Just change the option from fax to e-transmit on the progress note section and choose a P2P provider and go ahead and send it to them that way.
Great. So in stage 1, okay, practices could demonstrate their ability to incorporate lab results directly into their EMR. Now in stage 2, there's a very similar requirement for imaging results, correct? What are the requirements here, and what are my options to accomplish that?
So the requirement is that you have the image directly uploaded into eClinicalWorks and attached to your diagnostic imaging order. So you have two different options for how you want to accomplish that. The first option is that you could have a PACS interface set up. The important thing is that it has a link, and the link is to the actual image. So not to a dictated report, but to an actual diagnostic imaging result that is an image. If you are going to pursue that option, we suggest that you get started with that now, because that interface could take a couple weeks to set up. So you want to make sure that you're getting started on that early. The other option is that you can actually attach the image manually. So this would require you either scanning the image into eClinicalWorks or adding it from your computer, but just attaching it to the diagnostic imaging order, giving it the DI image tag, and once you do that, it will count towards your 10%.
Great. So a couple different options there. If you're going for a PACS interface, get started early because it will take some time to do. All right. So that is a menu item, correct? So essentially it's not really required, but why would a practice really seriously want to consider this particular measure?
Well, there aren't as many menu options in stage 2 as there are in stage 1. So you do have fewer to choose from, and we definitely feel like this is one of the easier ones to meet. And I can say personally that most of the people that I work with are pursuing this option because it is one of the easier ones.
So just a couple fewer options to work with, and this is one of the ones that we recommend. We're going to take a quick break, and when we come back, we're going to talk about configuring family history and getting those patients to interact with your office. Be sure to join us at the 2014 eClinicalWorks National Users Conference at the Orlando World Center Marriott in Orlando, Florida, October 17th through 20th. We encourage you to book your reservation early and to bring the family with you to this remarkable family destination. Please visit our registration website at specialevents.eclinicalworks.com to book your hotel and register for our 2014 National Users Conference. Welcome back to the eClinicalWorks podcast. I'm here with Kathryn Johnson, meaningful use expert, and we're discussing some of the specifics of how you can meet stage 2 requirements. So, Kathryn, in stage 1, or actually any time before this, recording family history used to be really easy, right? All I had to do was just open up the proper family member, type something into the notes, and move on, right? Stage 2 has introduced a bit more structure, though. Tell us about that.
Right. So in Stage 2 and version 10, there is a bit more structure. What is required for Stage 2 is that you have at least one structured data entry on at least one first-degree relative. So there's a little bit of setup that goes into that. You need to first customize which ICD codes you want to be present on your family history screen. So if you pick 5 to 10 ones that you see most commonly, that usually will suffice.
You don't have to go crazy and select everything, right?
Oh, no. Yeah. 5 to 10 usually works. So then once you select those, you need to make sure that they are mapped to SNOMED codes, which you can do using the Customize button. You can also give them custom names if you want, so that it doesn't have to have the ICD name that comes with the code. There is also an option for unknown. There's a SNOMED code for that and an ICD code, so that you can add that to your list for patients that don't have that have a non-contributory or unknown family history, and you can still get credit for those patients.
Right, because I think if I'm not mistaken, the wording of the requirement is that you have to have something structured for at least one blood relative, with close relationship. So that must be what that unknown status is for, right?
Right.
Meeting that requirement.
Right, because it does have to be a checkbox. Rather than, like the deceased or alive drop down. It does have to actually be an ICD-9 checkbox. So also really important is to make sure that you are mapping those first-degree relatives so that we know that those are your first-degree family members. And you can actually do that under the community mappings and just go in and match the left side to the right side and click map.
Right, so community, mappings, family history, right?
Yep.
And then do the setup from there.
Yep.
Excellent. All right, so another item in your list, and I think this is a big one for a lot of practices, at least the ones that I've talked to have been pretty concerned about this, is the patient interaction measure, or measures actually, because there's kind of two of them that are very similar, right? Core 7-2 and Core 17?
Yes.
What's the difference?
So with Core 7-2, they're looking to see that patients are actually logging onto the portal. The measure does state view or download or transmit, but since that is an or requirement, we count logging on as viewing. So the second that the patient logs on to the patient portal, you get credit towards that measure. You need 5% of all the patients that you see during your reporting period to actually just log on. Core Measure 17 is a little more involved. It actually involves the patient sending you a message from the patient portal. So there's 5 different options that will count towards meeting that measure. The first one is Ask a Doctor, New Appointment, Lab Requests, Referral Requests, and Refill Requests. So the more of those that you have set to show on your patient portal, the more likely you are to meet that measure. It's important to note that you don't have to actually have those routed to the provider. You can choose who you want each of those message types to go to in your practice. And also you can adjust the language on those. So if you want it to read differently on the patient portal, so for example, if you want Ask a Doctor to say ask a question or ask a practice, that's totally an option and it'll still count for meaningful use.
Right, so using those tools to kind of manage the way that your patients think about or see their interactions with you. And of course, like you said, there's those 5 options that are available. I mean, if I'm a patient, I'd probably find it easier to go through the portal and ask for a refill. And then if I'm doing that, at the same time, I'm also counting towards that 7-2 measure of view, download, transmit, right? So making those available is probably a pretty good strategy for practices.
Yep.
Clarify this for me. When they say 5% of patients, is that just 5% of web-enabled patients on the portal, or is that different?
It's actually 5% of all the patients that you see during the reporting period, web-enabled or not. So, the more that you web-enable patients, the better chance you have of meeting this measure because it is looking at everybody. We strongly suggest that you promote the portal. We find that when providers and practices are acting excited about the portal, that patients are much more likely to use it. They really respond well to that.
Great, fantastic advice. Exactly, you got to have that communication with patients. And then speaking of communication, communication's a two-way street, right? Patient interaction doesn't just involve the patient, but it also involves the practice. I'm going to go back to stage 1 again to bring back an example. But in stage 1, practices were able to get credit for sending appointment reminders to patients. Does this still count in meaningful use stage 2?
Unfortunately, it no longer counts in meaningful use stage 2. They want to see a health maintenance, preventative, or follow-up message sent to the patient rather than just an appointment reminder. You still can use eClinical Messenger, but what they want to see is some type of preventative or health maintenance. So just make sure that if you're using eClinical Messenger to meet this measure, that you're categorizing those messages as health maintenance to get credit.
So there's a little bit of setup involved, but once you do that, it should run pretty smoothly.
Yep.
Now, eClinical Messenger is just one way of doing things, sending those automated reminder calls, but there's probably a few other ways that I can do this as well.
Yes, so there's 3 other ways. One of those ways is by sending letters to patients. You just want to make sure that, again, the letter has an appropriate category. What counts is either preventative, follow-up, or health maintenance. Any of those letter categories will count towards this measure. The other 2 ways involve the patient portal. So the first way is really a passive way of meeting the measure. If you go into your patient portal settings, you can actually have the patients with alerts, either classic alerts or CDSS. You can have it set to where those alerts will show on the patient portal. For every single patient that has an alert, it will actually show up on their patient portal, and you'll get credit towards that measure without really having to do anything. The other way is if you generate a list of patients, you can actually send them an e-message. Just make sure that you're checking off the preventative or follow-up message checkbox on that e-message so that you're getting meaningful use credit for it.
Well, Kathryn, thank you so much for taking the time out of your day to speak with us today about the Meaningful Use Stage 2. It's been a fantastic help. For the eClinicalWorks podcast, I'm Adam Siladi. Please check out some of our other episodes on our YouTube channel. We've got all sorts of topics about our first Meaningful Use podcast. We've got ACOs on there. We've got patient portal and all sorts of things. Check those out, and also visit my.eClinicalWorks.com for some more of the supporting documents that Kathryn mentioned in this podcast. Thanks very much. We'll see you next time.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.